Good morning, internet
Good
friends.
morning.
Welcome to the Medicare Cafe. We are getting started. We are live. First of all,
We haven't been
I was just
together
gonna say.
in
a long time.
probably for sure over a month.
Has it been that long?
It's been over a
That
month.
makes my heart sad. The old band's back together.
I know.
Sadie messaged us because God bless Sadie, first of all, for organizing this
She's
herd
amazing.
of cats that does. And she's currently our producer today.
Mm-hmm.
But like she asked, I saw a message today. It was like, tell me your October availability, guys. Make sure we know what we're doing. And I'm like, I would love to tell you. I've been wrong every month. Every month. And that's something that my husband gets really upset with me because I have a famous line in my house that I say when I
What
get
is
back
it?
from a trip. And it's like, guys, this was my last trip of the year. I have nothing else scheduled.
5 more trips.
And then literally yesterday I got an email, hey, could you make it to New York to come do this one thing? And I was like,
Oh no.
I can't because I have an executive meeting that day. But I was just like, I'm literally not even going to tell Chad that I was asked to go. Because every time I come back from a trip, like last week I was in Florida, week before that I was in Dallas.
how you do it.
Doing all these things. And I was like, but it's my I have nothing else on the calendar. And Chad's like, don't even say that. Welcome to the
So you're
Medicare
going
Cafe.
to New York now.
I don't think so. We're going to
Oh.
see. I don't think I'm going to New York. Did you know today was the apocalypse? I didn't know this. I did not
The
prep you for this.
apocalypse?
Yeah, the apocalypse. The what's it called? The when you ascend into heaven. The rapture. The rapture's today. I did not schedule the rapture. So when I
Oh.
said I was done traveling, maybe
I
I'm not.
was like, are you saying a word wrong? Because I know the
No.
apocalypse.
No, it's the rapture. The rapture is today.
I didn't know that.
I didn't either. I had somebody
It's
tell me
happening today though. I thought that was supposed to happen of like, what was it?
There was
The Mayan calendar said that was going to
Mayan
happen in
calendar.
like 2020 or
I
something.
heard an interesting one too about the Pope. Like there was one that like there was no apparently where they hold like all the busts of like previous popes that like in some church in Italy, I think it is, and they said that the Pope who just recently passed, I say recently, that was a year ago.
Seems
but
recent.
The Pope, everything's recent. Everything's recent. The Pope who just passed away, he filled the last spot of the bus.
Oh my gosh.
So they're saying like there's
no
not
more.
another pope. So like so that was one. Did you know that, Sadie?
No, that sounds like prime laziness to me. They're like, well, we don't want to.
Sadie says that sounds like laziness.
We don't want to add extra room, so.
But apparently
That's
it's like hundreds of
God's
year
got to
old
come back
building.
between now and when the next pope dies
And they
because
only-
there's no more
There's
room.
no more room.
There's no more
It'd be
room.
real convenient, Jesus. So that happened, and then some. I think South African priest got a dream, and it said that it was happening today. So wasn't
it's happening.
So no pun intended. But when I was talking about how like I think I'm done traveling, maybe I hope I'm not done traveling.
Maybe,
Hopefully
yeah.
I got one more in me.
You've got one more.
Anyways, welcome to the Medicare Cafe. Today, guys, again, you're joined by your host. My name is Olivia Richardson.
And I'm Kari Vogt.
And we have one more Medicare Cafe in September before October 1st. And then it's September 30th, and that'll be next Tuesday.
Well, but AEP really starts for me this week.
Tell me about that. So just to set the
I
premise,
think-
today is it is a relax fit. We're just going to kind of talk about, fill the space for 30 minutes. If you have questions, comments, concerns, thoughts, or promises, this is my text line. Even if you're
Sadie's the
watching.
live chat on.
Sadie's got the live chat. Actually,
It says top chat.
It says top chat. Not that every chat isn't a top chat, but just saying. So you can text me at any time. I also, no, not going to finish that sentence. So text me at any time, even if you're watching the recorded version of this, or of course, if you're watching the live, you can text me or put a message out on our chat. But you said something, and I tend to agree. But you tell me, like you said, like my AEP starts this week.
It does for sure because I have 4 seminars this week.
Oh my God, Kari, how do you have time to be here?
I already did 2 yesterday. I had one at
Jeez.
6 a.m. And
Who comes to a 6 a.m. seminar? Was
So-
it in person?
No, it was
Jeez.
virtual. There was it's
has
a
the
factory in Kansas City,
Okay, yeah.
and
yeah,
they
yeah.
have like different shifts, and they wanted to make sure I got the night shift. And so the night shift and
that
the early morning
is-
one. So I had a 6 a.m. one, and then I had another one at 3. So those were virtual, which there was good attendance. There was about 9 people at each one from the company, but in person is just always better.
Yeah.
I like feed off of
Yeah.
the audience, and I just think it's just there's more interaction. But
Yeah. That sounds
they were
wild.
it was a employer plan, and or I mean the HR department, they're like, we have a lot of people who are 65 or older and our open enrollment is coming up. Can you please, like, basically, they can't say this, convince them to join Medicare before open enrollment. So hopefully some comes out of it.
Yeah, that's cool. Again, you have all these crazy opportunities that it's just like, I don't know. I think like you just are so organic and grassroots. Like if somebody could write a book on like how do you just build an empire.
Oh gosh.
I think like
no.
No, it's so true. It's so true. And so, like, I think for us, I can tell you for the team here at Senior Marketing Specialist, for a lot of us, not our support team, but we always get, it's always so funny. So I can kind of like what our calendar looks like leading up into AEP and then like in AEP.
Yes.
So leading up into AEP, we are, I don't want to be dramatic, but like, I think drowning is an appropriate term. Like, like the Q3 is our Super Bowl where we're talking plans, meeting with carriers, advocating for agents, getting co-op, figuring out what the carriers are, what's the vibes, what the carrier's going to do. So there's a lot of that. Then it kind of goes into, okay, let's get everybody certified. Let's get them ready. Let's get them familiar with the tech. Let's get them game plans going on and helping people understand, like, how do you organize your book of business for things like that. October 1st is when, I don't know how to put this in another way, shit hits the fan.
Yeah.
Because that's whenever we actually see plans and compare plans and run the side by sides. And like, we're getting ANOCs now. Like, consumers are like starting to get their ANOCs. So we're getting a lot of questions now, but it really just goes crazy.
I had
October
2
1st.
clients email me yesterday and was like, I haven't received my ANOC yet. What's going on?
What's going on?
I'm like, give it time.
It's literally
Still the 23rd.
I know. And but
come.
like, I can tell you the carriers who are wanting to shed membership sent those puppies out. Like they're like,
they getting them
the
out
carriers
early.
that are like, we have hope. We think we're gonna have a good AEP.
Let's just take our time.
You get it when you get it. I think that's like a really interesting like check of like how are these carriers?
Yes.
How quickly are they getting the ANOCs out? We don't want you on the plan. Figure it out.
So October 1st for me, I never schedule meetings. October 1st is empty for me.
Okay. Well, one of my questions I was going to ask you is like, October 1st is happening. You wake up. What are you doing?
I usually wake up at my like 4 a.m.
That's disgusting.
that I usually do,
6 o'clock
and I
seems less
just
crazy.
study the plans, and then I always.
How are you studying the plans? Like, are you using a spreadsheet or using tech?
I download the summary benefits for all of them in my area, and then I just look at them all and then make spreadsheets, and I just study them.
That's wild to me.
Yeah, that's
like
what
that's,
I do.
We are not the same.
That's
but like, wild to me.
It makes me more efficient the rest of AEP.
No,
if
there's
I
something
like
to
have, if I know them.
Yeah,
you know,
you feel more confident. There's certainly something to that. Like I've been telling a lot of people like that right now with Integrity Connect and like the technology, or just like getting your system down. Like people say, I don't have time to learn that. I don't know how. I don't have time to get into that. It's like if you take an afternoon or just a couple hours now, it will save you out compound interest. It'll save you so many hours
for sure
during AEP. I would say that you could probably take and just do the side by sides on Integrity Connect. Like you wouldn't have to go and download and create spreadsheets. It does that for you, and you could study it there. But if you're somebody like me, like if I want to learn something, I have to like write it out. But I'm also not trying to like memorize the plans.
No, I'm not trying to like memorize them. I just need, I don't know, I need the like physical thing in front of me to just soak it in. I don't know. I have to have the summary benefits.
Here's one thing that we're probably going to have to adapt to this year. We saw it last year. It's going to be even more so this year. It's going to be plan variety, especially in a place like mid-Missouri that's kind of like rural, but we also have like some good networks here. Like mid-Missouri is hard for us.
It's hard.
But like, especially in your more urban areas, we're going to see plan variation this year because like in the past, it was kind of like, oh, if you're in this county, 9 out of 10 of my people are going to be on this plan.
Yes.
Like I need to know that plan really well. But if something doesn't fit that plan, like a provider or something like that, I'll go and I'll start shopping then. But 9 out of 10 people will be on this plan. It's not going to be that way this year. It kind of wasn't last year.
I feel that.
It's going to be way more this year, where it's like you can't just kind of default to a plan and try to and then try to figure out if that plan won't work. It's going to have to be, you got to ask the questions.
For sure feel like I'm going to write a much more bigger variety.
Which isn't bad.
It's
like,
good.
I actually really like that.
Yeah.
Somebody says, good morning. Is it possible to find out what plans are being offered for a particular county? So right now, D-Row, I love that. Right now, the only way that you can do that, because carriers don't actually like publish them right now, is by looking at first looks. And we do on senior marketing specialist websites, we do have all of the first looks to where like you can just say like, what's Aetna going to look like in my area? What is, are not being offered.
Or not being offered.
So great question. I want to make sure I'm clarifying. Are you asking about service area reductions, SARs? The plans right now aren't making that. Some of them are being very clear about it.
Which ones are going away?
United Healthcare has published a lot of stuff about like these plans are going to be SAR'd. Aetna has done that some in their areas. If you're wanting to know, look at like at a whole like map, maybe you just want to click on a county and see like what's going away there and what's like maybe even like what's the impact, just not with my clients, but like for the entire United States. Wouldn't it be really cool if senior marketing specialists had a partner with Deaf Research that gave us an entire map that said exactly what plans were going away, how many were affected,
That
and like
would
with
be
the opportunity
fantastic.
income? Isn't that cool that exists?
It's a thing.
That's a thing. We had it
Oh
last
my
year. We have it this
gosh.
year. Call us because again, talk to our team. We can tell you exactly. Not all of them are loaded in there yet because we won't have them 100% certainty until 10/1 because some carriers are just not publishing that yet. But the carriers that have published it, they're uploaded in there, and you literally just call us and say, "I need to know in these counties what plans are no longer what plans are being SAR'd."
The short answer is yes. Call senior marketing specialists, and they can.
I wish it was a tool that I could give to everybody and like see this. It doesn't work that way. So you do have to call in and talk to us. But like we're cool people. Just talk to us.
Where is that information located on SMS?
It's not. You have to call our office to get that. That was a deal that we made to say that we wouldn't make it widely available. So you do have to speak to us, human beings. Or if you
everybody is wonderful to speak to at
just
SMS.
you don't even have to talk to me. You're going to talk to the people of our growth team, or you're going to talk to our agent support team. But yes, we do have access to that information. So call us. And again, it won't be 100% of the plans until after 10/1, but we have a good chunk of knowledge of like where's the opportunity, SARs, things like that.
Do you want to know what I do after October 1st?
Yes.
On October 1st, why I don't schedule meetings.
So October 1st, you don't schedule anything.
I'm looking at all the plans.
What are you drinking? What are you drinking that day? Is it a tea day, a coffee day, a wine day?
Not wine.
A tequila day.
Remember, I don't drink coffee anymore. It's been like almost 3 years.
I didn't know that.
And I keep waiting for the day that I don't miss it, but I still miss it.
It's like a ritual thing.
Oh, I make it and hold it and smell it sometimes.
Are you serious?
Yes.
Oh, you're an addict.
It's the whole thing. It's the whole
like
just
sitting on a
experience.
Drinking your coffee.
I don't do that a lot, but if I really like on a cold day, I will. Lice.
No, it's because I'm playing with my hair a lot.
Lice.
Brian's coming at me
Brian.
this morning. Brian, I'm gonna have a story at the end of it that really I feel so humbled today, and you're gonna love it. But not right now. We'll get to it.
So I have a list, my go list on October 1st that all my clients, I have tons of clients who don't take any medications. So something that helps me like jumpstart my AP and like feel good is like checking people off my list that I've taken care of them. And so I go through all of my no medication clients and I run their drug list. I'm like, okay, WellCare, the one you're on is still the cheapest. And I email, call, or text them. And then I get to check off like 30 people, 40 people off my spreadsheet.
That's so cool.
And I feel so good.
Something
I like started off by just feeling great.
So you're doing a lot of these things, and I understand why you're doing it. It's like to help you feel prepared. Like you want to do it by hand. Automation is not interesting to you in this. But for those of us who don't want to do that, it's really interesting utilizing, again, the Integrity Connect software. It automates all of that. So like we can create custom tags on there. And so when you're going through your clients, you can create a tag that says no medicines, like no medication. So then you can then make a filter, get all of your clients who you have tagged as no medicine, and be like you can like bulk send them. Like,
so I
this is
would
the plan.
absolutely do that.
So you can do that right now. That is a
I would
thing.
absolutely do that.
Yeah. So for those of us who don't want to do that, and maybe I've converted Kari into making life a little easier.
Well, in my defense, you know, what I do it as so when I send out my newsletters beginning of September, I think last week I told everybody I have like almost 300 drug lists back, which is amazing.
Oh, that's awesome.
And so as I go through my emails, I want to confirm that they still have no.
Yeah.
Even if I had it marked in Integrity Connect that they don't have drugs, like I would still, like when I get the email, I'm always like, all right, yep, no drugs. Like I have to.
Well, you could even tag it
You know?
as like 2026, no drugs, 2025, because it's a custom
True.
tag. You built it yourself.
Okay.
So like you could do that. And like eventually they are going to have things of like people, like they're going to have it like who takes this particular medicine. And you'll be able to filter people
You can
based on.
filter by that?
Not yet, but that's coming.
I can't tell you how many times I've been like, man, I wish I could search what client takes Repatha, because I get a question about
Yeah.
Repatha and I'm like, I know they had a drug grant. Who was it? Can't remember.
Yeah, that's coming. So
Oh,
it's coming,
that
but in
is
the meantime,
amazing.
it is talking about just like what you can create your own tag. So like some of them have done like no medicines, because it's just like, oh, well, are they still not taking no medicines and things like that? So you can like even do like no medicines as of 2025, no medicines in 2026. So you could do that, filter it, be able to send those plans out. But it's again just looking for like
Yeah.
all the time saving things.
Yeah.
So you do that.
I
That's
like
the
that.
end of the day on October 1st. It's like, so you're filtering, you're looking at your clients, you're seeing exactly like what can I get done in bulk right now? Who
Yes.
can I move?
Yes.
And like, so that I can have my end, who needs to see me?
That helps me to just feel like productive. And then I start having like my meetings with current clients on the 2nd.
I love that. And it's something that like, again, not everybody is going to move this year. We know
For
there's
sure.
a ton of market disruption. There
Yep.
was last year. A lot of people stayed on the same plan. And I love what you're doing because it's addressing the fact like not everybody will need an appointment. Not everybody will need to move, but everybody needs to be communicated with.
Yep.
So if somebody is not moving, you can't not reach out to them and not talk to them and assume that they know that they're okay for the next year. So making sure that you can communicate with these individuals. Again, another plug for Integrity Connect. They have that DEF CON system. So it will actually, like what it does is come October 1st, you can pull a list of your clients and it has like a 5-point DEF
Oh,
CON.
yeah.
So who all my clients who are experiencing an SAR, that's a DEF CON one.
Yep.
And it will pull up a list of clients. You know, those are the people that I need to meet with, all the way down to the formulary didn't change, their medicines didn't change. It looks like they're on the right plan. They're a DEF CON 5. Reach out to them, talk to them, but tell them they can stay on the same plan.
So I love all of that. So I need you to help me though. So like I've had this for 6 years. I just like my spreadsheet.
If the spreadsheets work for you,
because I also have on there like communicate, like I color code it, you know, like, all right, people that are red, like we're meeting with first, people that are green, like we're done. And it's so awesome. I can see at a glance, like
you can
throughout.
create a custom tag of like,
But can you see everybody, like
Yes.
all your clients
Yeah.
at once?
yeah. Yes.
Like that? Because like I can
And you can
see
even
in November,
export.
like, okay, I'm like 3/4 of the way done, everybody.
You can export a list of your entire clients onto one of your spreadsheets
Okay.
and be able to look at those tags too. But like,
Maybe.
if that works for you, I'm not trying. But what I'm trying to do is people who are trying to find extra time and like Kari, the fact that you do this, I would love to know, show of hands, if you don't feel comfortable, text me, who does that much work leading into AEP where you get a spread list of the plans, spread list of the clients, spread list,
spread
spreadsheet,
list.
a spreadsheet, like that. You're literally doing all that. I think that's incredible. I feel very confident saying 90% of agents do not do that. And I honestly think with the technology out there,
me feel good, Olivia.
I'm just saying, like, it's impressive. I've been doing this. This is my 13th AEP. I've never heard of this before. Of somebody, I have heard of it. I've heard of people saying, I'm going to do this. And then October 1st, shit hits the fan. They're doing none of it because they just didn't budget their time.
How do you not look at the plans though?
You're looking at the plans, but honestly, what it comes down to is each individual that you meet with, you have the ability now to like talk to them during the meeting, run the quote, and the technology is telling you what the plan
For
is
sure.
on.
I do that, but then like I feel like
And now
I'm
the technology
better.
is telling you who do you need to meet with.
But like if I have 3 plan comparisons pulled up that I'm going through, like I can just talk about it so much more confidently than just like reading through like, okay, UHC has 750 of dental and, you know, like
Yeah.
I feel more confident in it.
I think that makes sense. I think you should. But there's some things like like that for you, that brings you confidence. So
Right.
don't change it, right?
Yeah.
Like you have your time budgeted for it. It makes sense for you. That makes you confident, then don't do it. But if there's ways to like organize your clients or eliminate like understanding, like helping you organize your appointments or helping you estimate of like what does like my calendar look like this year, that you're not having to go through and look at each client, look at their plan, saying like, should I change, should I not? If you're not having to do that by hand and can do that automated, then like maybe that's something you need to look into. So it's not like all or nothing. Like do what works for you if you can justify it, but then also like if it's something that you're doing that's repetitive and it's just because it needs to get done as this repetitive thing, then that I guarantee there's an automation for that.
Yeah.
That like you don't need to spend your time doing that, or your assistant's time spent doing that. So, but if it brings you confidence, then do it. That's the silliest.
I don't think I'm doing too much work.
Like I'm always doing too much work. I feel very confident in that.
I just run the client's spreadsheet. Like I do it out of our like Falcon system, like our CRM.
Yeah.
Like it does it for me.
Yeah. Well, then like again, like
So
then you're doing automation. It's just through a different
Right.
platform. Yeah. If you're I don't care if you're doing it like I don't care if you're doing automation on some crazy expensive thing, or if you're doing it, or if you figured out, I don't know how spreadsheets work. Excel formularies give me hives. I have no idea. Like you like how they think of the formulas that like literally people can make Excel spreadsheets dance, and I have no idea how it does it. It gives me hives.
I can't do that.
But like people can, and like that works for them. By all means, do it.
Quit telling Care Bear what to do.
Excuse me, it's Medicare.
It's Medicare.
Brian,
You
put some respect on her name.
That's right.
With the budget cuts, some local. Thank you, and good morning, Terry. Terry's my favorite. Good morning. Good morning. With the budget cuts, some local hospitals may close. Where is it better to check that out? Okay, that's such a great question because we're
Say the question again. Hospitals are
basically
closing.
like a lot of hospitals, especially like rural hospitals. A lot of rural hospitals are closing. They just can't afford.
I don't like that word secretly. I just don't like the word rural.
I don't know how to
like the
say
way
it.
feels
Rural.
when it comes out.
ROADs. Some country doctor places, they be closing. And
Stacy, I love you. She does spreadsheets.
I think
You are now my favorite person.
I think why not both? Like use the technology. You know you can upload and download spreadsheets from Integrity Connect and from Falcon. And if your CRM does not allow you to do this, then get a new CRM. Like
Hashtag Medicare Bear.
Medicare Bear. So a lot of these local, I'll say local smaller community hospitals. They are closing due to like changes in the reimbursement rules, due to a lot of factors. A lot of these places are having to close. So a couple of things that you can do as far as like how do I detect that? So Medicare.gov actually has a pretty cool resource that you can actually look up doctors, look up physicians, find out if they're accepting new patients, find out if they accept Medicare assignment. You can do all of that on Medicare.gov and like help find and search these providers. The big thing I would keep in mind is remember that if a provider does change, get dropped, loses in the middle of the year, that's not an SEP. So like if somebody does close in the middle of the year and that person uses that doctor and they're on a Medicare Advantage plan and there are rules associated with how many doctors and providers you have to have within a certain radius of that county, of their area to be compliant with CMS. There are things like that, like some safety nets to put in place there. But yeah, just keep that in mind. Like, so Medicare.gov does have a really cool feature that allows you to reset
I didn't realize that was happening.
It is. Yeah, there's a lot behind it. A big part of that being like what's going on with like the big beautiful bill. Again, a lot of people were worried about how is the big beautiful bill, the big beautiful bill. What's going to affect Medicare? It kind of indirectly is. There's not a whole lot that was a direct impact to Medicare, but there was a lot to like Medicaid and who can qualify for Medicaid and reimbursements for Medicaid. So a lot of providers that are accepting Medicaid are going to really struggle with this. And so that's part of the reason why we're seeing some of these closes. So what time is it? Oh my gosh, it's 10:24. We didn't get to any of my stuff. Which is actually like the best.
I feel like I just
I'll tell you what,
the conversation.
It was important. It sparked conversation. I have enemies now who love. I'm not anti-spreadsheet. to be clear, I'm not anti-spreadsheet. I think spreadsheets are super helpful.
Brittany too. Love technology.
I know.
Spreadsheet.
I think that if you are having to spend hours just filling out a spreadsheet to do nothing more than create a resource, not to help you learn, but just to create a resource, do not spend your time doing that. Like if it's to create a resource, automation's creating that resource. And I
will
think
say the biggest drawback to my spreadsheet is sometimes I'll leave notes on there that I don't also put in my CRM.
yeah.
That sometimes has got me.
Yeah. I was an enemy before you were cool. Brian, you've always been my enemy. And I feel really proud to say that. I've always been an enemy. Brian's been enemy number one for me for a while.
Any other questions?
So I'm not getting any other questions on here. So what I had prepared today was maybe a bit of an ego stroke. I will admit, whenever I've been there, I asked ChatGPT, hey, can you tell me what Medicare Cafe is? And it went through and gave me a full description of Medicare Cafe, who our target audience was, when like a bunch of stuff, who is Olivia, who is Kari, Sadie was on there.
Oh my gosh,
a full
that's
description,
scary.
Which was, I thought it was hilarious.
That's awesome and scary.
So then I was asking, like, because today we're just doing
somewhat
a
scared of
relaxed
AI.
Yeah,
I'm
is
scared
scary.
of Chat.
I've seen the chat. I've seen the Terminator. But one of the questions I asked is like, okay, so if you could ask Olivia and Kari questions, what questions would you ask them?
Gosh, this is
And
fun.
it went into questions from industry, Medicare Insight. So here's like the I don't know what I'm trying to say, like the groups categories. The categories of questions is. Oh, and it even put whenever I said, can you generate some questions to ask the host, Olivia and Kari? And it literally said, girl, you got it. Oh, it does know the vibe. It knows the vibe. So it says, so there's industry and Medicare Insight, for agents and business growth, personal and show related, including things like what inspired you guys to start the cafe, things like that. And then there's some specific AEP market and regulation changes, sales and strategy, client education and experience, and then the personal show and angle again. So it did have some really cool questions on here. I know we are almost out of time today because we did cover a lot of stuff.
Hit us with your favorite.
October 1st. I actually
the best question.
didn't even read them.
Oh.
Because like some of them I did. Here's one. Let me do this one. Now it's quiet. Dead air. What strategies do you recommend to help agents? And comes out of the sales and strategy one.
Okay.
What strategies do you recommend to help agents stand out during such a competitive AEP season? How do you stand out in such an incredible AEP season? That was one of the questions that they asked.
It's too intense of a question
It's
for my brain.
a very intense question. The only thing, and I said it last year, I'll say it before this year, this AEP, we will have more engaged audience than we've ever had before.
I already feel it.
It's
for sure.
So many
my
people.
clients.
And we saw like last year, like people were asking questions, like people were engaged
I've never had
last
people
year.
email me like, I haven't gotten my ANOC yet.
That's
never happened.
That is 100% not. That is 100%
I'm like,
happening.
okay, that means you
everywhere.
read my letter.
You read
Because
my
it
letter.
said you were going to get an ANOC in September.
Here's what's happening. So last January. So how many year people are just like, oh yeah, this AEP is coming up. I'll do it when I get to it. Like the plans didn't change very much year to year. They went crazy last year. January 1st, even as busy as all of us were, it was the biggest. We wrote
so many
apps last year. It was the biggest AEP ever. So many people did not get help last year. So many people did not know they're supposed to get help this year. So many people woke up, went to the pharmacy January 1st, could not see their doctors, could not get medicines. A lot of them did not have coverage because they did not read their ANOC. They never had to read their ANOC in before because it's been kind of the same, some slight changes. They never had to before. They didn't. They woke up January 1st with nothing or with something bad. They're not going to let that happen again. So you had everybody who was engaged last year, and then millions of people who are engaged, will be engaged this year that were not engaged last year because they're not going to get burned again. So you're going to have more people than ever raising their hand saying, I need help. How do you stand out? Partially is get there first. which is hard. And I think an online presence is going to be, you're going to have people who are engaged. And when people are engaged and have questions, what do?
They go online.
They go online and they seek help from friends and family. So if you can get in that process first using online resources, whether that be TikTok, social media, Facebook, LinkedIn, or having your personal website, get in there, get that information out, make it easy to access, make it easy to share, and remind your clients that you have it, to say like, hey, if you have somebody that's asking questions about this, send them my information. And then October, you don't have a time to sit down after October 1st. Like, you have to be as engaged. You have to start working October 1st on this.
Anything for 10 weeks, guys.
You can do
it's
anything.
Just 10 weeks.
It's just 10 weeks. And so you have
really
to
hard
be
8 weeks.
You have to be loud. You have to be consistent, and you have to keep your promises. Like, you have to return those phone calls. You have to get in front of the people. You have to make sure they have access to your stuff. So if you can't replicate yourself because there's only one Kari, there's only one, even with your assistants, you can't,
No.
Everybody wants to feel confident and comfortable. You can't do that one-on-one by yourself. So having an online resources, videos, instructions, educating people this year, educating on what to expect this year, the louder you can be online, the better off you're going to be, and make it really easy to refer you. Make it incredibly easy to refer you. A lot of people do like give you $10 for every referral or like you can enter into one of these contests. People don't even care about that.
Oh, gosh.
They just want to be the person that gave their friends good advice.
For sure.
So you just have to make it easy, give great service, and make it easy to refer you.
I agree with all that. I'm trying to think if I have something to add, but you hit the nail on the head there.
It's the one thing I have. Is everything's a nail whenever you're a hammer. Guys, that is our Medicare Cafe episode. Maybe next week, as we kind of maybe do kind of a what does ChatGPT want to know about AEP? That might be a really fun one. So we might do that next week. But appreciate you guys for hanging out with us. We've had a great time doing this. If you have any questions, comments, concerns, threats, or promises, let us know. Or like, again, guys, we'll keep this going all through AEP. It will be shorter episodes, maybe some more fun stuff. Just giving you like what we're seeing in the industry. What are we seeing the first few weeks of AEP? We'll keep you guys in the loop. Another question they had on here, we don't have time to answer it, but like, what's the number one question agents ask during AEP? Like, I want to get some I want to get some follow up from like our agent support team. Like, tell me what's the number one question that you guys get. So cool. Any final words before we're raptured?
No.
All right.
We just need to end on that.
Cool.
Great last episode.
Okay, we'll see you next week. We'll know.
Maybe.
So until next time, guys, have fun.
Make money
And give impeccable service. Thanks, guys.
Thanks.
I really wanted to go,